patient satisfaction, which is a pretty broad, I guess, thing to consider, but it's every day that we have the opportunity to interface with someone and help them continue to function in their life more effectively, because we're trying to give them the best vision they can have as long as they can have it. I was inspired primarily by my brother. My brother was like 7 years older than I was, and so I got to witness his life journey and tried to emulate that, I guess. But what he was doing looked pretty cool at the time, and as a little kid, I got into that habit of, well, I'll just do that. That looks like a lot of fun. So, and sort of followed his path, and ended up, finding myself in a pretty good place for quite a few years. Choosing to go into medicine and exploring the different options, the two things that ended up being on the table were geriatric medicine and ophthalmology. Two disparate fields, and so one is like internal medicine based, and that at that time when I was going through my training was a new field. It wasn't an area you could subspecialize in. So I went that direction a little bit. Actually went and spent some time in Queens in New York City, and was at what became the first residency program for geriatric medicine. And then after that, weighed in the balance and decided to come back to ophthalmology. But now, fast forward a few decades, a lot of my patients, probably the majority of my patients, are in that geriatric population dealing with the subspecialty that I take care of. And so some things work out. A fellowship-trained subspecialist in vitreous and retinal disease. So it's common things like diabetes. Those patients sometimes have complications that affect their retina. Circulation problems that often come with aging or some other health issues. So there's some vascular stuff that happens in the retina that we end up taking care of. And then age-related macular degeneration is a big part of it. And now there's more things that can be done for that. So that population that we've served and then can actually intervene and do something for it continues to grow. And so again, a gratifying thing to be able to provide that. We consider patient-centric care an important part of how we interface with our patients. So we like to think, as our branding suggests, that we have a specialized sensitivity to dealing with the patient beyond just their eyes. And so we hopefully have an open communication, and a big part of their involvement is first making sure they are educated and understand what the issues are that they're confronting and dealing with. And especially for a lot of the patients that I deal with, they're embarking on a treatment course that may go for months or perhaps the remaining years of their life. And so they have to be well informed and understanding and have realistic expectations so that they can navigate that journey and hopefully be able to celebrate the vision and then celebrate their life experience a little more effectively. Yeah, a good balanced life, which, nutrition for a lot of these patients, that's a key piece. And it's often like the question, well, what should I take? Well, let's start with what you should eat, good nutrition, and then supplement appropriately to complement that. Physical activity, your body is working together and so you provide a better place for your eye and the visual system to live and work if you take care of your whole body. And then for some people, just be careful. So if you're physically active, and especially, the sports examples of, those related injuries with flying tennis balls or whatever the sport might be. And then work risk. And so people appropriately should be protecting their eyes, depending on what they're doing. Yeah, the people, I think. And trying to make Ilumin a place that doesn't, shout medicine and healthcare when you come up to the building and walk through the door. And hopefully it's a more inviting place. I think it's one of the conceptual things that we did when we thought about what Ilumin should be 10 plus years ago, was to create an environment that was comfortable for us that work here, to put us in a better place, so that we, without thinking about it, may translate a better experience for the patient being in that space. And there's a correlation, proven correlation, that situational environmental piece does translate to better outcomes for lots of things.